Hello, everyone, and welcome to the Science North podcast, Give Vaccines a Shot, where we'll explore the latest in vaccine news, learn all about the global health pandemic we've been facing, and have an opportunity to learn about the importance of our immune systems. We'll be doing all of this through the lens of our expert guests. This month's guest is Jennifer Jocko from Health Sciences North and Neo Kids. Dr. Jocko is an obstetrician and gynecologist at Health Sciences North and medical director for Neo Fertility, as well as an assistant professor at Northern Ontario School of Medicine. She is a member of Algonquins of Pikwakanagan and worked as a registered nurse for 10 years in Mattawa and North Bay before becoming a doctor. In our conversation together, we speak about the importance of vaccines during pregnancy. Here we go. So Science North received funding from the Public Health Agency of Canada, and we're working on increasing vaccine confidence with a campaign called Give Vaccines a Shot. And vaccines have definitely been top of mind in the last 2 years with the pandemic, but they are an important public health measure with regards to pregnancy. And so we would like your expertise and knowledge to help us address some misconceptions that there might be around vaccination and pregnancy. And I was doing a little bit of research, and I realized that recently public health guidelines have changed a little bit in the last few years with regards to vaccines and pregnancy, and that there are certain vaccines that are now routinely recommended. Could you sort of address that, like which vaccines are routinely recommended during pregnancy?
So the vaccines that are routinely recommended, so every year we do an influenza vaccine campaign every fall. And we also do a diphtheria and pertussis vaccine. It's called Tdap. So it's part of the tetanus vaccine, which is actually like 3 vaccines in one. It's been a recommended vaccine. We've been doing it fairly regularly since about 2019. And then just most recently, the public health has released a guidance document that is, or guidelines that have recommended pertussis booster, which is whooping cough, in every pregnancy, regardless of the time frame between pregnancies. So every pregnant woman in the 3rd trimester.
So I think that might be one of the things that is sort of a new thing. A lot of people are saying, oh, I was never told to get vaccinated during pregnancy. I have children that are sort of in their early teens, tweens there, and I wasn't recommended vaccines. So this is a sort of a new thing. You were saying 2019 was something that it's become a routine thing for pregnant people to be vaccinated against?
Exactly. And it's been around for much longer than that. Health Canada, I think it just things take a little bit longer, it seems. But we've been doing those vaccines, like I said, even the influenza vaccine, we've been doing annually for a number of years now, pretty much for the length of time that I've been here. We run an annual vaccine clinic every fall. And obviously in the last couple of years, we've also been encouraging and recommending women be vaccinated for COVID as well in pregnancy, not just for protection for themselves to decrease the risk of severity of illness if they were to get COVID, but also to provide some protection to the new babes who they depend on passive immunity from the mom. Basically, babies are provided passive immunity by moms who have been vaccinated. They make antibodies. They pass those antibodies on to the baby. And what really protects them the most is when they get a vaccine, especially in pregnancy, especially 3rd trimester. The baby is then born protected. And for whooping cough, we can't really measure the titers of when our immunity to it wanes. Tetanus vaccine is something as adults we are supposed to get every 10 years. Back in my emergency room days, if you came in with a nail in the foot, it's been over 5 years, you got a booster of your tetanus. And because we are vaccinated right through our teens until we're 14. So babies start getting their vaccinations at 2 months, and what they know is that with the with various whooping cough outbreaks that occur, the baby is most vulnerable in the first 2 months of life if they do not have enough immunity to whooping cough. And if a newborn gets whooping cough, it's not good. So that's why I've been really encouraging we offer the vaccine to all of our patients in our practice at 28 weeks when they come to the office. The health unit has, kindly set us up with a vaccine fridge. We've had this vaccine fridge for a number of years, so we are pretty much on top of making sure our pregnant patients are vaccinated.
When you were talking about your vaccine clinics for the flu, I'm assuming that you want to recommend the flu vaccine during flu season. Like, do you probably, like, right now although right now it seems that flu is having a resurgence sort of at a time of year that we don't normally get flu, but I guess in the fall you're more likely to recommend the flu vaccine to pregnant people?
Right. So that when we are vaccinated women in October, November, our immune systems will be adequately boosted for the flu season that starts generally in the early winter, February, March. Yes, there's been a resurgence in this last, probably strangely, the last 1 to 2 months, I would say. It's been one of my patients had influenza about a month ago or just over that, and she was quite sick with it, actually. But thankfully didn't need to be hospitalized. And that's the benefit to a lot of the vaccines is being vaccinated prevents you from hopefully getting severe disease that lands you in the hospital, lands you in ICU. People also misunderstand the flu shot or the flu as, vomiting, diarrhea, but influenza is actually respiratory virus. And pregnant women especially are most at risk because of our immune system changes when we're pregnant, and that causes us to be more at risk of severe complications of things like influenza and or COVID.
So when we're recommending the flu vaccine and the COVID vaccine, most importantly, it's to protect the pregnant individual from getting severe illness, which could lead to complications.
Right.
Correct. And then when you're recommending something like the Tdap vaccine, or also if you end up having the COVID vaccine sort of later in pregnancy, that also can confer immunity to the developing baby.
Speaking to pregnant people about it, it's really hard to protect a newborn because a newborn can't wear a mask. And I often, the conversation I have with people is that, we're 2 years into the pandemic and we're still talking about bubbles. And I talk about bubbles to my patients still. And I say, you need to protect your baby. And we are still talking about bubbles, and the people around or in the baby's bubble ideally should be vaccinated so that they're not bringing COVID to them, and other things, physical distancing, making sure people are wearing masks if they're not vaccinated, making sure they're not coming to visit if they're not well. Back in the day, when you had a baby, especially growing up in a small town, everybody showed up eventually. And it was like this, people were coming in the door, they're bringing you food, everyone wants to hold the baby. And then all of that obviously all of that went away, but it's starting to come back a little bit. So I'm trying to remind people that it's still here. So we need to protect, we need to protect you. We need to protect the new baby.
And the babies are getting vaccinated, but what's the earliest that the babies are being vaccinated? What age?
So, so if we talk about whooping cough and whatnot, they start their vaccinations at 2 months. The COVID vaccine has not been approved in infants as of yet. I think they're looking at some evidence, they're doing some studies with possibly doing it in younger children. But yeah, not as of yet.
It's a very difficult time when people are pregnant and they're sort of told some conflicting things. Could you sort of explain the difference about so some people say, well, I don't take medication, or I was told I wasn't able to take certain medications because of complications that could arise. How is a vaccine different from taking medication?
So the vaccine, the way it works, so when you get a vaccination, it's typically an intramuscular injection of a vaccine. The vaccine then produces antibody response. that antibody response is what you want. You want those fighter cells to fight off the virus, basically. Those antibodies are what gets passed through the placenta to the baby. So they've done studies. There's been no byproducts or anything that they can identify as a vaccine in the placenta. So if you can't see that in the placenta, you're not going to see it in the baby. It's so true that women have suffered so much over the years, for generations, from taking them off of all of their medications for managing like a mood disorder. And we know now so much more about mental health medications and safety in pregnancy, that it's much better to have someone intact, both physically but also mentally and emotionally, with the medications that she needs to do that, rather than take off her medications and have her unstable and not, be in a good place, emotionally or mentally. And so a lot of women suffered with that. Even to this day, I have conversations with women. When I first meet them for their first pregnancy visit, I try to dispel some myths. I talk about, foods, activity, exercise, vaccines. Those are the big things that I talk about. And that's the problem. It's like, oh no, you're pregnant, you shouldn't have a Tylenol. You have a headache, you shouldn't do. There's so much misinformation, and especially social media. It seems that people are pregnant. It's almost a permission for a complete stranger to give you their opinion on the food that you're putting in your mouth, or how you're carrying your baby.
Or everybody knows the right way to sort of to go through the pregnancy, right? Like when I was your age or when I was pregnant, this is what I did. Yeah. So you were mentioning things like food. There's a lot of myths around food. I think even when I was pregnant, one of the things was told, like, you need to avoid soft cheeses, deli meats. And then I found out that, in fact, the soft cheeses thing had to do with unpasteurized milk products, which we don't actually have in Canada. So it wasn't really a concern.
And a lot of that misconception is about salmonella, things being left out in the sun. So egg salad, macaroni salad, Caesar salad, some of the really good, obviously the people who do take the time to make real Caesar salad dressing has egg in it. But this is salad that's chilled.
Yeah.
So it's really kind of taken out of context. And I tell people that, they ask me, especially in the summertime, people ask, can I have a hot dog? I'm like, yes, you can have a hot dog. Lunch meat is about listeria. And so if it doesn't smell or look right, probably don't eat it. That my children both graduated university, and I definitely had more than one hot dog when I was pregnant. So you just got to kind of, just normalize it, that, it's become a little bit overwrought with misinformation, and we battle misinformation and the internet on a daily basis. Patients tell me what the internet tells them, or what they've learned in those social media groups that probably don't have anyone in there that's an expert, or a medical expert, I should say. And it takes a lot of work we put a lot of work and effort into encouraging vaccination in pregnancy, since even before Health Canada finally released it. We were screaming at Health Canada to let us vaccinate our pregnant people. And I tell my patients, I'll drive you there. My husband be having a heart attack, but I would be making sure that I'm vaccinated.
Yeah. Well, and I mean, I think a lot of the recommendations are, when you talk about the listeria thing, you want to avoid food poisoning in general, because that's something that you would do as a non-pregnant person. You would try to eat food that is not contaminated, and you need to practice good health and food safety with that.
Right. And most of those places, they ask, can I go to, some of those sandwich places? I'm like, yes, you can go. They're like, oh my gosh, I've been so craving this type of sandwich. I'm like, you can go. It's okay.
I know some people are sort of concerned about the type of vaccine, especially with the COVID vaccine, because it is a different technology. Do you spend time explaining to your patients about how this is not necessarily, that it is actually a vaccine, that it is going to confer immunity, not necessarily immunity, but will protect them against severe illness?
So I find that probably in the first year, once the vaccine was out, there was a lot of conversations happening about the type of vaccine and its safety. A messenger RNA vaccine, they are quite safe. They don't cause any pregnancy complications, fertility complications. There's no problems with the baby. It's modeled on similar to like the flu shot, and so I tell people that type of vaccine we've been doing that vaccine for 10 plus years for pregnant women. So there is a lot of good evidence, despite it being somewhat new. That the science and technology behind it is not new. It's COVID, and there's so much. It's such a hot topic, depending on what group you're in or where you're at. But really trying to get the proper information out there is always challenging. I feel that social media has miseducated people, and fairly bright people. It's mind-boggling at times, and I feel that half of my job is sales. If I could sell things, I'd probably do really well. But basically, what I'm trying to do, I'm trying to sell the vaccine. I'm trying to sell their safety. I'm trying to sell their well-being, and also, the more of us that get vaccinated, hopefully, eventually, this virus will be something we vaccinate every year, and it becomes something like the influenza. We prepare for it in the spring. It's I hope that we would get somewhere eventually.
We might have covered this, but is there evidence to say when is the best time to be vaccinated against COVID within the pregnancy? Do you earlier in the pregnancy, later in the pregnancy?
I encourage women to get vaccinated at any time in the pregnancy. Certainly, a vaccination in the third trimester will confer optimal immunity for the baby when they're born, because you're passing those fresh antibodies, you're passing those on to the baby. But I tell people, especially if they're entering my practice and they're not vaccinated, and they're 12 weeks, 14 weeks, please be vaccinated, because you will still pass antibodies on to the baby, but really also just for yourself and the risk of infection and severe disease and being admitted to hospital. I just encourage it at any point that someone will consider it.
I was just thinking about how, I was talking with my colleague, and I'm at a year, this past weekend was a year that I got my first vaccine against COVID, and I haven't had any long-term effects from it. But so you might be encountering pregnant people that maybe they have their full set of vaccine, they're already double vaccinated, and so maybe recommending the boost. Do you think that this might be something where it's like the Tdap, like a booster is recommended sort of later on in the pregnancy?
Yeah, so I will, when I have patients that come into the practice that have their 2 vaccines and don't have a booster, I have a conversation with them about the booster and encourage it. And it's still, I think people are still, if they've been vaccinated outside of pregnancy, they're okay with that. But when you bring a booster in pregnancy, or just a vaccine in pregnancy in general, it kind of gets people's backs up a little bit. But I've certainly, after a lengthy conversation, people have gone on to become vaccinated, and it's like, well, pre-COVID, it would be a high five moment in the office but we high five from afar. Oftentimes they're like, "You'll never guess what I did," and I'll say, "Did you get your booster?" And they're like, "Yes." I'm like, "Awesome."
Oh, that's great.
Yeah.
Well, hopefully we can start to normalize that getting vaccinated in pregnancy is not something to be feared, and that it is a normal part of the pregnancy and confers protection to both the pregnant individual as well as the developing baby. If somebody is pregnant and does have questions about vaccines, where should they go for information?
So I typically recommend the Health Unit website. The Society of Obstetrics and Gynecology of Canada have some excellent resources. We have some resources on our website, neowomenshealth.ca. My coat, where's my own, looking backwards here. Hospital website. Yeah. What's the, it's escaping me. Health Canada. Yeah, there's tons of really good data out there. The Born Registry, or Born Ontario, is another good. It's accessible to anyone, to the public. Born collects births in Ontario in hospitals, and they register all births in Ontario registered in the Born database. And what they've been capturing is vaccines and pregnancy. So women who are delivering babies and have been vaccinated in pregnancy for COVID, we're probably, I haven't looked at it recently, but I'm pretty sure we're probably in the more than 100,000 range of babies born in Ontario to women who've been vaccinated. And those babies are fine. Those women are fine. What we don't really talk about, is people say, well, the side effects of potentially a vaccine, is that we don't talk about the effects of long COVID.
Yes.
So, back in the day when you used to put everybody in a room, children in a room to someone who had chickenpox, everybody get chickenpox. But what we didn't know, and why we have a vaccine now for chickenpox called varicella, was because there are some children that lost their limbs or died because of a chickenpox infection. So it's not as benign as people think. And we have and now children get vaccinated. It's part of the vaccination series for chickenpox. So I'm not quite sure I was going with that, but when we talk about COVID infection, it's almost like I want to go see that person just so I can get it, so I can be done with it. The problem is you don't know if you're going to be that person who's going to have severe infection or end up with long COVID. Long COVID, there's so many different things that continue to happen to people and really cost them quality of their life with long COVID. So that's the other side of it too. It's not as benign. People have, unfortunately, there have been too many lives lost to this COVID-19 pandemic.
Before we go, just is there one little essential nugget that you would like to leave us with regards to pregnancy and vaccination?
Pregnancy and vaccination is safe. I can't emphasize it enough. And I'm happy to drive anyone there who might need one. We eventually, hopefully, be at our office, at our clinic, we'll be offering that. I can foresee probably a COVID booster. We will be signing up for a shipment once that certainly program has started. We have we have the busiest obstetrical practice. We will be right up front trying to ensure that our patients feel safe that they're getting vaccinated. Is definitely hopefully one of the things that we provide, is that vaccines are safe. We, as the medical experts, have done the research and hope that we can win over the internet sometimes.
Thank you so much for taking the time to answer my question. Your expertise is greatly appreciated.
Thank you for having me. Miigwech.
What I love about the conversation was learning that many of the tales of what we can and cannot do during pregnancy are just that, tales. Make sure to consult your physician if you have any concerns. Thank you so much for listening. See you next month, where we'll explore another part of viruses, vaccines, and the immune system. We also want to know what questions you have. If you have any questions based on this episode or about vaccines, viruses, or the immune system in general, please reach out to us at our email, vaccines@sciencenorth.ca. We're always happy to address those questions. If you want to find out more, visit our website, sciencenorth.ca/givevaccines-a-shot. Also, follow us on Facebook, Instagram, and Twitter. And if you're listening or watching us on YouTube, please be sure to follow. Lastly, Give Vaccines a Shot is funded through financial contribution from the Public Health Agency of Canada. The views expressed herein do not necessarily represent the views of the Public Health Agency of Canada.